Morning, everybody. I'm Owen Phillips. I'm the Involvement and Engagement Officer of CADR. So hopefully I'll be able to alleviate some of the concerns in terms of who hasn't met up and who hasn't been supported with us. So today, looking at our 10-year mission to boldly inspire, involve, and engage. You might recognize that line from somewhere, but there we go. So what does good public involvement look like? That's the first question. Obviously, Pete's gone through in detail in terms of the National Institute for Health and Care research standards. And again, they're a superb sort of baseline and starting point to actually look at using best practice. In other words, creating impact through active involvement and engagement. It's great saying we've contacted so many people, but we found that we've been active and we actually had people coming back to us asking for more throughout CADR's delivery period. So we always share research with the wider community, and we enhance the voices of older people by building involvement and engagement. So obviously we hit the quick count out there, the sixth target, communications, working together, inclusive opportunities, making sure that it covers as many people as possible, looking at supporting people, how they can learn through us as well, careful governance, and obviously leading then onto impact, which is always probably the trickiest part, but it's obviously the most valuable part as well. Now with us, CADR was actually one of the pilot organizations working on the NIHR standards as a test bed. So we're instrumental in setting out that kind of area there and setting out the groundwork for those standards. So who are we? We have Pete in the room here. So we're funded by Health and Care Research Wales. So obviously an agent of the Welsh agency of the Welsh Government. A lot of this you've probably heard covered already. We were originally OPAN, the Older People's Aging Research Network, and migrated over to CADR in around about April 2015. So at that point, we did include Cardiff University. Now we're led by Swansea University in collaboration with Bangor and Aberystwyth, and certain other locations on a global front as well. So what are our aims? What do we set out to do? Simple. It's a nice, simple statement. Our aims are to improve the lives of older people through the integration of research, policy, and practice. Trying to combine all the different factors which actually make a difference can make a difference as far as the lives of older people and people with dementia are concerned. So to address this, we undertake a number of different areas, involving and engaging the public. And I love that photo at the top right. It looks like everyone's having fun there. So hopefully we'll take some shots after. And we'll have the same reaction from the audience in here. So involving and engaging the public, making sure our research addresses the needs of older people and people living with dementia and also their carers as well. Assisting in the transfer of research findings. So moving that into clinical and social care practices in Wales. Involving and engaging policymakers and practitioners. It's great being operational on the ground, but if you can make a difference as far as policy is concerned, that's obviously where the money is, I guess, to an extent. And that funding then actually leads on to action and activity. And developing business and clinical links. It's not just about health, but it's also about, it's not just about health businesses, but it's also about businesses which support people in the health area as well. And we look to contributing to the health and wealth of Wales. So in terms of our activities then, so we're arranged into a number of work streams, in fact 4 work streams, which are all interlinked to enable us to focus on one area, a bit like Pete's diagram earlier, where we've got the environments of aging, or the eco strand, characterizing dementia and cognition and aging, or the bio strand, social inclusion for health and well-being in later life. Covers kind of psychology or the psycho and social aspects. And then work package 4, which I'm part of, are looking at research methods, public and professional engagement, and involvement. So in addition to what our sort of day-to-day activities, we also co-produce a number of activities with Joint Dementia Research. Obviously, they mentioned the Arwen Institute in the main hall earlier, enabling research in care homes, or ENRICH, the Active Building Centre, or ABC, and a Centre for Innovative Aging, or CIA. And again, the diagram on the right-hand side might be a bit complex to read from the back of the room, but we can provide larger versions should they be required. Okay, so all this sounds great. It's all kind of a bit ethereal in a sense, where you're looking at what's going to happen. But in terms of actual practice on the ground, we have a centre. The Owen Centre, based in the Talbot building in Swansea University. With a centre to actually run it, we've supported the development and delivery of dementia research, focusing on supporting communities, housing, transport, environment, workplaces, and loneliness. We've raised awareness of cognitive impairment and dementia and other aspects in between, and supported a ton of research in collaboration with the NHS as well. Our activities across the board, we formed a number of multidisciplinary research groups, and we also got a thriving postgraduate student group as well. A lot of this, it's going to be a potted look at CADR, if you like. We've done so much activity over the last 5 years that I've been involved in personally, but over the last 10 years, it's actually astounding. So trying to get all in one presentation, you might find that's why the slides are a little bit cluttered. Okay, so we work with a whole range of organisations across Wales. Lots of third sector and voluntary groups. I've got Fincher up there as an example. Looking at creative conversations with them. We looked at yeah, of course. Sorry. Sorry, Kat, I didn't even recognise you there in the back. I do apologise. I want to say the lady there. Brilliant stuff. So again, we work with the Welsh Ambulance Service Trust in terms of improving dementia care on the ambulances and some of their projects there, right across the board. We've touched virtually every organisation in Wales, I think, in terms of signposting, in terms of dementia and ageing. I'll go on that in a bit more detail in a second. Obviously in Bangor, we have the CADR group as well, which are the people living with dementia and their carers, looking about what's important to people affected by dementia. One of the interesting things that we found is that a lot of organisations who are trying to support people with dementia, and certainly commercial organisations, don't tend to actually involve people with dementia when they're producing products or support items for them. But a couple of surprising areas where that didn't happen. So we're quite happy to make and involve those kind of connections to make sure everybody works together. Now, obviously, we support the Welsh Language Dementia Care Subgroup, so the Welsh Government, and we respond to outcomes from the Alzheimer's Society and Welsh Language Commissioner's report as well. And Pete mentioned earlier the Marie Curie's PIRIT tool, really good, and obviously through our collaboration, we actually started using that, and it's phenomenal for public engagement. Really, really useful. Okay, so looking at engagement, we try to be as innovative as possible when we're undertaking events or just day-to-day interactions. So where do we start? Obviously, using the NIHR standards as a baseline, we looked at developing an integrated involvement and engagement plan, trying to tie together all the different agencies, all the different people, all the main players in the field, so that we could get the message out in terms of what we're doing. First step is standardizing documents. Quite, that sounds so pedestrian, doesn't it? It sounds unimportant, but what we found, I think, is with standard documents going out, it made a difference to how people actually perceived CADR in terms of the feedback we had. Obviously, events, we've been at a lot of different events, which I'll come on to in a bit more detail later. Or the usual kind of round up the usual suspects as far as how we actually engage with people. Printed materials, community radio interviews, and in fact, we found that a very successful route to get the word out to enable some of our researchers to talk to the public, and we had a massive response from that kind of approach. Commercial radio proved to be too expensive, unfortunately, but community radio feedback we've had has been phenomenal. Obviously, we've got a social media presence, so LinkedIn, Facebook, originally quite strong on Twitter, possibly less so now with some of the changes which have occurred. Again, with our activity, I started my work, I started my job during lockdown. Didn't meet anybody for, that's been about 2 years, I think, afterwards. Lots of nice Zoom communications, but obviously we had to make the switch then towards digital communication to make sure we're engaging in as effective a way as possible with people. So monthly newsletters, we had 52 of those over the last couple of years. Monthly webinars as well, very, very effective. Some really interesting topics. I'll come on to those a bit later. But one I was particularly impressed with was dementia in the Welsh language and some of the challenges that people who have dementia face when when their first language is Welsh. And obviously that also applies then to a number of people who English isn't their first language as well. Interactive games. Now, if you see, you've got the beautiful Rian over there and Kim, our other team members in the main hall, standing on board what we like to call snakes and CADRs. So the idea is you win, you chuck the dice, you head up the board, and you answer a question. Dementia. If you answer successfully, you move on. If you don't, you sort of slide back down. So that's fine. We were going to bring a copy today, but we weren't sure if we had the floor space to actually put it in. So obviously, conferences, videos, podcasts, photo competitions, you name it, virtually. Any type of engagement we could find, we'd hit it. And the thing we're most proud of is our mobile app. Now, not many people can say they've got a mobile app. Can they, Pete? Yes, okay. So we developed a mobile app. The idea was that, obviously, when you've gone over to a completely digital sense of delivery, it's extraordinarily difficult to engage everybody, and certainly older people who tend not to engage with technology in the same way as everybody else does. So as a result, we looked at what was happening and how to get our message out, and decided that a lot of people will tend to use a mobile phone, whereas they won't actually use a computer. So as a result, our mobile app was a good way to actually engage people on an individual, a more personalized basis than you might have found using a PC. It's been very successful throughout the Derby. It's been absolutely. So really good. And obviously those links are live. So if you're so interested in downloading it, you've got, what, about 3.5 months, really, I think, while it's still going to be live. So I'd definitely give it a try now, so at least you can see what it looks like and possibly give it a try yourself. Okay, so in terms of the actual delivery, we've looked at a number of individual programs. One, I think, which the main speaker mentioned earlier, was the lay summaries program. And there, one of the issues with research findings is that they're not often accessible to the public. It's more difficult, perhaps, to get into what research actually means and how it impacts people as well. So we asked a number of members of the public to assist us with one of our key activities, which was publish and disseminate research findings and lay summaries. I can see that question coming up now. What is a lay summary? I know it's on the roof of everybody's mouth there. So it's a brief summary of a research project used to explain complex ideas and technical and scientific terms to non-experts and people who don't have prior knowledge of that subject. So to cut the long story short, it should be easily understood, written in plain English, free of jargon and free of acronyms as well. So hopefully this presentation is also going to be meeting those criteria. So obviously to deliver our program, we developed a volunteer handbook, because they're all volunteers who will get some recompense for their actual time. We use then OASIS, which is a document writing guideline, as a way to standardize our approach. The next big program that I've been involved in was the Research Advocates Program. So the idea here was that we were looking at how to expand CADR's reach and how to expand how people interact with us and how they find out knowledge about CADR as well. So our aim was to promote research and expand involvement in engagement activities. And together we co-produced an induction program along with further learning resources. So there's essential resources, which uses the NIHR standards, and also then support resources, looking at how to undertake research, how to undertake funding, and those kind of things. Program's still available, so if anybody wants to discuss it, I'm around later on, and we can send you links to that as well. Okay, so the hope was that we'd have one or two of our research advocates here today to actually explain it in more detail and make it more real, if you like, rather than me just stand up here talking about it. Unfortunately, I couldn't make it, but effectively, what the research advocates do is they help us shape research questions, support us in terms of bid writing, bring surveys, support events, disseminate research, and lots more. We're also, CADR, one of the other main claims to fame for CADR, I think, is that we promote joint dementia research in Wales. And obviously, it's a national organisation looking at dementia research and how it can be made more effective and trying to involve people in undertaking research in that kind of area. Very good organisation. I'd certainly look him up if you can. I think Kat was involved in the setup there as well. In terms of active connections, again, it's a very similar slide to what Peter had earlier. Thank goodness for smart art on PowerPoint. So we cover a whole range of different organisations: volunteers, business and industry, third sector, local authorities, local health groups, individuals, but mostly people, as well as the Welsh language agenda and those kind of different areas as well. Effectively, too many to list on that slide. The important thing with CADR, I think, is that right the way through, again, based on the NIHR standards, our activities represent real life. We ask questions. We look at what older people actually want and what's important to them before undertaking research. And that has made a huge difference, I think, in terms of involving people in our activities. All our outcomes are evidence-based and underpinned again by quality indicators from Healthcare Research Wales. That's us. And to summarise, so we've worked with 293 organisations. These figures are approximate. They're based on me going through my list of all the people that I got my email. We have 28 lay members who undertake lay summaries and also do some engagement work for us as well. We have 11 research advocates, and whereas it's about 1,500 a year or so ago, we've sort of rationalised the database down. People have moved on, so we're down to about 1,175 subscribers at the moment. So we actively engage with that number of people during our average week, really. Or certainly at the end of the month when our newsletter and webinars go out. Okay, so one of the things we do particularly well, I think, is signposting different activities. We've worked with a whole range of projects. So you might be aware of these, you might not, but I'll just mention them here. Get There Together, videos looking supporting by people affected by dementia during COVID, during the pandemic. People Speak Up, based on in West Wales, and about connecting people and making healthier, cohesive, and resilient communities. So rather than an individual basis, more based on community itself. DOES or Choice Wales is their information database. Digital Communities Wales, which do some amazing work in terms of connecting people to digital resources so they can feel more confident and comfortable using them. And also Dementia Friendly Swansea, although that should be expanded to Port Talbot, and I think they're creeping further east and west as we talk. So based in the Dementia Hub Information Centre in the quadrant in town. In town, in Swansea. So if you're down there anytime, please go down and have a scan. So lots of research commissioned. We've got transport and older drivers, got a crucial area at the moment with Dr. Amy Murray. Hearing loss and the Hearing Loss and Place Project, Dr. Emma Richards. And Dr. Deborah Morgan, who's our loneliness specialist, often called Lonely Deb. She's great, the most interactive person I've met, but she's always called Lonely Deb. And she's curated a range of loneliness resources, produced a Making a Difference pocketbook, and with through some other European funding streams, produce some icons booklets so older people, or in fact anybody, can understand using a mobile phone or a tablet or a computer. It's brilliant. Again, copies of those are available to download on our website, so please grab them while you can. But yeah, they might indeed. Thanks to the factory. So again, I mentioned some of the webinars earlier. Some quite interesting, in fact, very interesting ones again. Designing for dementia, falls prevention, producing dementia-friendly locations, and tools for research. There's a whole swathe of those on our website, so take a look, and please use any of the resources that you can, because they're all really worthwhile. So in terms of impact then, what's different about CADR? What's made us transformative? Obviously, okay, so it might sound run-of-the-mill again, but online media with videos, social media, our photo competitions have always proven really popular, and our CADR calendar as well. I was going to say it's an annual event, but of course you'd expect that for a calendar, wouldn't it? so yeah, okay, so I'm going to start sounding a bit obvious there. But again, you'll find in your packs, I think you've got a copy of the calendar in there. And we also produced then a dementia and aging news archive. So based on different sort of scientific papers and different sort of general popular science, looking at some of the resources you can actually pick up there. So we produced the music CD for well speakers living with dementia. There's a project by Professor Charles Musselwhite. There's nothing pedestrian about being a pedestrian, looking at transport and some of the challenges older people feel or face when they're trying to access public transport. That's train, bus, or just getting to different locations. On a range of other influence events, cognitive impairment to missing health checks, the Wales Centre for Public Policy. The list could go on, to be honest. I had to condense it down just to get a couple in here. One of the ones I was particularly keen on was improving older people's lives through digital technology and practice. Again, using that kind of interaction with people to make people more comfortable with using technology. Range of different presentations. Deb's loneliness guide's on there as well. It's so good, I've featured it twice. Other sort of areas in terms of migrant aging and the environments of aging and designing for age. So published output, which is, I suppose, the real impact here, apart from the people who we've interacted with, 137 CADR publications, 125 public engagement events, 68 public engagement opportunities. So again, quite a, okay, it's 5 years, but that's more than 1 month in most areas. So it's, we've definitely interacted with a whole range of people to be able to transform those activities as well. Our whole ethos, what we're about, it's involving and engaging the people and getting research out. And that lovely new term, surfaced in different ways. Imagine the submarine coming to the surface there. That's what we're about with the research. So research support, obviously you mentioned about early career researchers and PhD students, and in fact people in general who have an interest in aging and dementia. See some events there on the right-hand side. And our main focus is translation of research into impact. Number of significant presentations. Again, some have been mentioned already. That's Dr. Liz Jones there in the centre at a really interesting project looking at involving engineering, I think it's by Navan County Council, and preserving the historic legacy of Troyd Review. So that's up in one of the valleys. And the idea was that it was an abandoned village, effectively. Because it was abandoned, the church was abandoned, the cenotaph was abandoned, and the aim of the project was to make young people understand how much sacrifice was made during the first and later wars. So it really was looking at, again, if anybody wants any more information, happy to talk about it later on. Okay, so what's our direct impacts? Again, I know it sounds like reinforcing right away that we're a best practice activity, but I think we are. Again, a range of other research projects undertaken. Bride at the Spice of Life, really fun. Food Glorious Food, even more fun. We didn't have any freebies those, but it was a good project. And obviously presented at the Campaign to End Loneliness International Conference as well. In terms of government impact, which again, it's where the money is really. The Dementia Action Plan in Wales, we were part of strengthening the provision in terms of COVID-19 response. Carers are an area which are kind of underrepresented. I know one of our other speakers is talking about them today. That's with Diane. But certainly making personalised short breaks meaningful. Looking at the future research agenda, connecting the research on carers in terms of how we could support them in terms of short breaks. Designer for Age, mobility in the decade of healthy aging. Obviously, that's that 10-year plan going back in action. And CADR, by the way, has led the way in research and innovation excellence initiatives. It's led to nominations and awards. Fortunately enough, we were voted the most interactive display at the 2022 Health and Care Research Wales Conference. So you see, it doesn't show up there. So we've got the award back there, and the thing at the top of the screen with CADR written over it, that's our hologram. If you ever get a chance to hear an action, it's brilliant. It's really, really exciting. The problem is it's a bit dangerous because the blade spins and you could lose limbs when you're when you're there. But we didn't bring it today. But if anyone wants to see an action or discuss it further, just let me know later on. So we've been nominated for the Swansea University Involvement and Engagement Award. We were invited to present our CADR at the Exchange event, looking at, again, bringing researchers and local citizens together. And we've also delivered some Dementia Friends sessions as well in collaboration with the Alzheimer's Society. Well, times okay. So I've been here kind of effectively boasting about all the great things that CADR has done over the last 10 years. But I think it's where you're actually able to bring in other people to see what they've said about it that makes a difference. Lena Hercott, the previous OPC. So our conference would make an enormous difference in giving people ideas, enthusiasm, commitment, and shared learning. I think it's a lovely statement. That's some other conference delegates. Our feedback right the way through has been good to excellent. So it obviously means that we're reaching some people and making a difference. Judy Morgan there said, CADR's work around ageing is absolutely crucial. It will help the Welsh Government to determine a strategy, not only for ageing, but loneliness and isolation. Vital stuff. My favourite one is from one of our research advocates. I won't mention my name, but he came and said, thanks to the CADR calendar he sent me, it made my day that somebody was thinking of me. Lovely. Okay, so I think, yeah, thank you. Hopefully this is going to play. Okay, we might not have sound enabled, unfortunately. There we go. Okay. So that's keeping with that Back to the Future sci-fi theme. Got a bit of a Star Trek theme going on as well, which might get a little bit loud and a bit overwhelming. So I hope I can pause it, so you can see my voice going up in levels then as the music plays. So it's just like I say, really, a massive thank you for everyone who's engaged with us, worked with us, supported us over the last 10 years. It's been fantastic. Oh, nope, he's coming back again. engaged twice. Yeah? So I'm Owen Phillips. I'm the Involvement and Engagement Officer with CADR. So obviously, if you have any questions or you'd like to look at anything in more detail, please give me a shout afterwards, and it'll be my pleasure to talk to you. Okay? Thanks, everyone.
I just wondered, from experience with my mum, there's is that I just wanted to ask about, you mentioned it, that my parents came from the Caribbean.
Right. Okay.
Obviously, English is my parents' first language.
Right.
But since she's diagnosed with dementia, she's reverted back. I mean, they've been here over 60 years. She's suddenly start speaking in a very strong Jamaican dialect.
Good grief. Okay.
And I just wondered whether, is it a similar thing to Welsh speakers?
Absolutely.
Well, no, is that?
Some do. Some will revert to using certain Welsh terms in a conversation. Some will revert to using Welsh exclusively. So it really all depends on, I think, the type of dementia and how much, or how significantly it's affecting the person. So it's like with any kind of health condition, there are so many variations, unfortunately, that you can't really specify on one. But it's definitely the same. I think even irrespective of the language you actually speak, I think that does seem to be a common issue with dementia, that it will make you revert to whatever language you're most comfortable with.
People doesn't speak like Welsh or German. It's very difficult.
It started before she had for about 5-6 years after she was diagnosed, before she went to the home, and she just started to speak differently. So she basically went back to her childhood.
Okay.
Even though she's been away over 60 years. Speaking English.
Yeah.
Normal. So I just wondered whether.
Unfortunately, with dementia, I think, and a lot of other conditions, they affect everybody in a slightly different way. But I mean, that does seem to be a fairly common trait with dementia, that if you're speaking another language, that it'll make you revert to that area. Sorry.
What happens, what's been found is that people with dementia do revert to the language they were brought up with. So there's a lot of people who are reverting to just Welsh. Whereas they would have learned from perhaps the home and gone to them. Once they got to maturity and reverting, that's an issue around.
Yeah. Interesting.
On the Gower, they used to be Irish Gower because there were lots of business walls.
Oh, okay. Wow.
Yeah, she really
Already I am Danish friendly ambassador volunteer.
Right.
But I have question for you and Peter here about who receiving care allowance or unpaid care. Yeah.
Okay.
Did you or any organization in Wales did any kind of research if who receiving this allowance they are happy for the carers or no? Because why? Sometimes, while I'm walking in the street, even here, I found older people over 60, they lost.
Yeah.
Maybe they're looking for someone to help to us with this risk.
Sure.
Okay. Already they have people who are receiving care for them. Yeah.
Yeah.
But why they are not with them? Yesterday, while I'm going back to home, I saw in my eyes very old man. He opened the main door and he tried to talk his rubbish outside because collecting to the lawn.
Yeah.
And when I saw him, I said to myself, he become very hard while where's his people who taking their money for to take care for him.
Yeah.
So I don't know if there are any kind of research done, or it will be in the future if they, the older people, they are happy for what, for the care or not.
I think I can't think of any research specifically on that area that we've undertaken with CADR. But it's not to say that the research isn't out there. Obviously, I'm not. I'm more involved in engagement or a people person rather than a researcher. So probably wouldn't be able to answer your question specifically, but I'll certainly have a look for it. Are you aware of anything?
No, I know there's a centre for Aging Research Care. There might be some research in there to be like what level of support people want from their care, but no, in terms of top of my head, no, I don't know.
Yeah.
Yeah.
No, I'm just thinking if we
Yeah.
can take this in our account in the future, because we want to make sure if the CADR there, the aims to help the older people, yeah.
Absolutely.
We should ask them, are you happy?
Yeah, absolutely.
People who,
Funny enough, because you mentioned you were working with Cardiff. We've actually worked with Cardiff's Age Friendly Forum, I think it is, with Rosie.
yeah, it would be, I mean,
Well, yeah, I can't remember her last name, but yeah, I agree with you. It would be nice if the Alzheimer's dementia friends training was kind of expanded. And I think that, sort of on an organisational basis, I know that Cardiff's made some great strides in terms of becoming a dementia friendly city. And I think Swansea's undertaking the same kind of approach as well. But I think, obviously, it's like with everything else, you can always go that much further to actually make sure that everybody gets the support they need.
Sometimes people fall through the gap as well.
Absolutely. Absolutely. And I think funny, it was one of the things we were saying earlier that it can be really easy to fall through the gaps, but it's knowing how to ask the question to get yourself out of the gap is pretty much the challenge that I think that we've found. I'm sure that everybody else can probably empathise with that point as well.
Over the years, I've been in the circle, health and care research Wales, and even CADR, but recently now it's going more technology. It's the apps, it's it's more webinars and that sort of thing.
Yeah.
And I feel it's going to go too far, and you're going to lose touch with public involvement. I feel you've got to, the only way you can feel what's going on in the room is if there's someone in the room.
That's okay. Yeah.
You can't pick it up if someone's got their camera off.
No, that's right. Well, some of the conferences we've been at, sometimes it's a good thing they've got the camera off as well. But no, yeah.
Sarah, then we've got 40 people, all the time, and then lockdown, unfortunately.
Yeah.
Pushed us to the digital age, and then we have tried to do it back. I think we've had about 4 people in the room, we've done hybrid, so.
But
I ended up in for the Owen country.
All right, yeah. I remember meeting you up there, yeah. In the university or at Talbot, that's right, yeah.
So I done it voluntary, this is what I do it.
Yeah.
But then years ago, Health and Care Research Wales would have made it happen for me.
Yeah.
But they're up to the picture now. I have been trying to reconnect with them, but it looks like it's all Sunday now, and the public involvement is way more.
Yeah.
As long as you've got the up-to-date app on the phone.
No, that's right. I mean, it's what with technology, it's always a two-edged sword as well, Laurie. Because
but like an example, we know, I was given an invitation to come. And I looked around this morning, and there was quite a few of us there, but I can't recognise any faces. So
I was saying,
I didn't get the expenses.
right, okay.
For the train fare. It wasn't much because I even had a special card to get the train fare lower.
Oh.
But then Health and Care Research Wales used to do that sort of thing.
Yeah.
To get you the form and maybe even help you fill the form in. But I think a lot of people have dropped that out. It's all virtual now because they cannot fill the forms in, or if they fill the form in, does it go to the right place? So
It's, yeah, I mean, absolutely. I mean, like, digital isn't the answer to everything by any means. I mean, but like I was saying earlier, it can enable certain other people who might not have the chance. What we found, a good example with our conferences, the first two we ran, it was mostly people who were based wherever the conference was. So you'd have a lot of people from Swansea, or a lot of people from Cardiff, or a lot of people from Bangor. But once we went online, what we found was we had a lot more people from rural communities sort of engage in. So, yeah, well, absolutely, yeah, globally. So so on the one hand, it enables some people to communicate with us, but on the other hand, it can put some people off as well. And yeah, I agree with it. I mean, because a lot of services have gone digital, I mean, DVLE is an example. You know, you can't get help filling out your driving license application and stuff down there anymore. And I think that's a definite barrier, and it's going to need to be addressed. But how are we going to address that? I don't really know. I think, you know, it's going to be a lot of, my projection is there's going to be a lot more concentration on terms of voluntary services to be able to undertake that kind of activity. But if that's a good thing or not, again, it depends what side of the divide you sit on, really.
It would exclude a lot of people that we've been desperate not to exclude from taking part in games. But I really think, you know, health parents as well are moving down that path, and over I don't know, we've got to think about that in terms of other centres. So, for example, rural areas, you just said it helps people, but I've lived in rural areas where you can't even get the internet.
Yeah.
We had a large scale project, the cognitive function and aging study, and we did some work around technology and why people do or don't adopt technology. And it isn't because a lot of older people can't. Sometimes it's because it doesn't serve any purpose for them.
Absolutely.
They don't have people that might help them reboot a computer when it messes up, or you don't have a digital connection. You're not going to use it. So there's got to be a range of different ways of involving people, because otherwise those people who've already got barriers end up having barriers.
Absolutely. And, you know, I think right the way through Canada, I think most organisations nowadays, in all fairness, we try to hit as many people with as many resources as possible. It's not to say that our message or anybody else's message gets through to everybody, but we want to make sure it gets through as wide as possible. Yeah, I agree. I mean, you know, digital, in one respect, is a panacea. Saves money, saves a lot of resources. But on the other hand, is it as effective? Possibly not. You know, we've had lots of conversations here in the crowd in terms of recognising people on a Zoom screen. I've had about 15 conversations in the last month where I've been talking merrily away to somebody over the screen. I don't recognise him in person. It's
When I went
yeah. Right.
We moved that during the pandemic and stuff, but there's more outreach. So the community events we talked about, Discovery Roll, was going out to different communities, not expecting them to come to us. Same as we put on events for our public members as well as our researchers, and we invited people to come to them. But like Rian said, very few uptake from public members. I think the pandemic has hit more so than what we realised in coming through engagement events. So, and there's cover for consumable and travel and stuff, so we still cover that stuff. It's not solely digital based, more like a hybrid role.
Okay.
I just want to say I work through Health and Care Wales, and we do an annual conference, and it's always in person, always have hundreds of people in right to the middle of it, and then with COVID, we have virtual conference. Ever since we've done hybrid, we're kind of the option. And I think
definitely.
It would all our conferences are usually hybrid.
Yeah.
Because they're all in simultaneous sessions, we just everything's recorded. The budget will be up.
All of our breakout.
It's just difficult to organise, but sometimes some of them don't.
Yeah. Absolutely. No, definitely. Well, for the conferences I was talking about, it's just interesting that they altered the demographic or the mix of people who were attending. because previously we find it difficult getting people in from rural areas, whereas once it was online, there was much more take up. But of course, then there were less people locally. So, you know, it's kind of a two-edged sword. But we always run everything virtually where we can, and in a hybrid format where we can as well. Okay, can I know I'm eating into your lunchtime.
What is the age of the older people between?
Depends who you ask. Depends who you ask.
The older people.
Well, I've just gone up another tick box, you know, in terms of the questions you normally get asked. So it all depends. It's as old as you feel, and as old as the person feels, I think, is the best way to answer it. So it could be anywhere. You know, you can feel old when you're 15, or you can feel old when you're 75. But yeah,
because young people in Wales are 40 to 25, but that's 60 plus. 60 plus, yeah.
Then
it used to be 60 plus with Europe. Yeah, that's right. Yeah.
The old Constitution of Wales designates 60 plus.
Okay.
But then arguably that should increase as well.
Yeah. Well, listen, everybody. Well, thanks very much for your questions. Thanks very much for a great interactive session. I would just like to give you a big hand. Okay, so again, hope you enjoyed it. Please go ahead.
Yeah, so it's lunchtime now, and what we're going to do is after lunch we're going to go straight into our next sessions at, well, for 1:30, and then after the session it's in the main room for finishing off. So thank you very much.
Thanks, Mary. I'll be wandering around if anybody's got any questions at all. As well. Thank you. You go.